as some of the lines
It is so cool.
come into our building. Because ComEd was doing a sweep of all the surrounding areas to see who didn't.
Oh yeah, he's pretty nervous.
Building came up with that. It comes in 3 phases. 2 of the phases are very good. The third one is completely out of line. And that puts electric motors and stuff in jeopardy. And so that's what they're trying to find out.
How are you? Good.
We had 5 new board members
If
when
it
that first
trips
came on.
our breaker,
We had 5 new board members.
Yeah.
replace it, and we could do that.
All right.
Are you discussing December 1st first in place yet, or is that?
Not publicly. Get away local. Firm I was in practice with before. Not a firm, but some lawyers that I was in practice with before. I didn't want to go back to Chicago. I met with the firm, I met with another firm. I don't want to do that.
Well,
So I'm not
it's
here tomorrow.
our whole
You're somewhere else.
The what?
recruitment method is to find.
Send it.
Yeah, I think you said that a day or two ago.
Yeah.
Or maybe I saw it on your stuff.
Are you
You said on
tired of
my
this?
schedule. I just sent it to him.
Right.
Yeah.
You know who I think is there? Is
Email this morning?
Cross there? Is he with you guys now?
Results come back in tomorrow.
Yeah, I mean, I'm a little bit out of touch with,
Yeah.
with the new hire, because they had like 36 when I was there, and they've got 45 or 6.
Oh, they do.
I got it.
Good morning.
Yeah. No, Hinshaw.
Morning.
About less than a year ago now, and
Okay.
they're like, we'd like to have you back, and
We had there's a group
All right, I got it.
of office managers or firm managers that
Mhm.
did.
I should have it. Yeah.
Go home for
Um,
I forget what the name was called. The management roundtable. Everybody's probably really. Anyway, one day I can tell you about training. And the topic, it was really always a valuable meeting. And it was basically because of the ramble on that.
Labeled as a HP
I said,
C12D.
Frankly, what we do is, I said, we try to hire people from larger firms with experience. That
Yeah.
and the one guy was in a suburban office of maybe Ice Miller. I forgot which firm. He said, "Yeah, you son of a bitch." He says,
You're taking all my
you hired
associates
three away
after
from
5
us
o'clock.
in the last 5
I
years.
know. But it's, they're great training. I mean,
Well, it is.
it's really good training. There's a lot of, say what you want about big firms.
Michelle.
There's value to them. You've got
Well, there-
people that just practice in a very narrow area. And become
And they've
that
got the
area.
resources.
What's that? Oh, yeah.
Pretty good. How you doing?
Yeah, no. Hopefully in the next couple of weeks I'll be ready to.
Look, he's got an official shirt on today. Huh?
I don't even have an official shirt.
You could get one.
Who do I talk to?
You have to buy it.
From where though?
We ordered King County shirts.
Really?
Yeah.
Okay.
You could go to the jail and they give you a shirt.
The ultimate. We'll see.
Sheriff, you'd give him a new shirt if he was in jail, wouldn't you? Sure, if he checked in as a resident.
Good morning, everyone. The hour being 9:01 a.m. on Thursday, August 13th, I'd like to call the Judicial and Public Safety Committee meeting to order. First order of business, roll call.
Martin?
Here.
Iqbal?
Iqbal present.
Kenyon?
Here.
Lewis? Sanchez?
Here.
Thomas?
Thomas present.
Do you have a quorum?
Okay, we have a quorum. First order of business, I need a motion and a second to approve the minutes of the July 16th meeting. Moved by Mr. Kenyon, seconded by Mr. Martin. Any changes, additions, deletions, corrections? Seeing none and hearing none. Please do roll call.
Martin?
Yes.
Iqbal?
Yes.
Kenyon?
Yes.
Sanchez?
Yes.
Thomas?
Yeah.
And Leonard?
Yes. Minutes are approved. Is there anyone here for public comment? Seeing none, we'll move on to the monthly financial reports, and we have Ms. Raymer Holmes here to report. Erica can't make it, and she was kind enough to come and give us a report.
Good morning. Thank you for having me here today. Hopefully you can hear me through the mask. The July judiciary reports are included in your packet for your review. I'm here to highlight today, just in the general fund, the coroner's office is trending above the recommended budget amounts in almost all categories, including salaries and benefits. In today's agenda, there is a budget adjustment for your consideration. In the special revenue funds, those that are higher than the recommended budget have now been reviewed. And in every single case, there's enough fund balance to cover those current expenditures. Of course, I'd be happy to answer any questions you might have.
Any questions for Ms. Raymer Holmes? Matt, thank you very much for the report.
Thank
We
you.
appreciate it. Moving on to the state's attorneys, Mr. McMahon.
Good morning. Just briefly on kind of activity in the office, we're really seeing a return to normal on types of cases and the volume of cases coming into the state's attorney's office on the criminal side of the office. We saw what I would call a temporary, I guess, slowdown kind of early in the COVID-related pandemic. But over the last 2 months, both the type of offenses coming into the office and the volume coming into the office is really reflective of the last couple of years. So that's unfortunate, but it's just kind of a reality of the size of the county and the issues across the county, from especially in cities like Aurora and Elgin and some of the other larger, more urban communities. The action item that I have on your agenda this morning is I'm asking you to consider a resolution. If you want to introduce that, I can then talk to it, or I'll
Yes,
follow
sir.
your lead.
If you wouldn't mind, I'd like a motion and a second to have Mr. McMahon present it. Moved by Mr. Kenyon, seconded by Mr. Martin.
Thank,
Mr. McMahon, please go ahead.
Thank you. So this is a proposed amendment to the ordinance that created the Judicial Public Safety Strategic Planning and Technology Commission. That's the body that meets. It's a group of citizens, judicial partners, county board members, retired judges, works with Roger to address IT needs in the kind of the judicial system, circuit clerk's office, judiciary, my office, public defenders, et cetera. So this is just really a house cleaning amendment to that ordinance that created that commission to align the election of a new chair of that commission following the expiration of their term, as opposed to the start of a specific date. We had a vacancy for longer than we should have. This will clean that up and allow the commission to vote on it immediately at the meeting after the term expires.
Very good. Any questions for Mr. McMahon on that? Seeing none, hearing none on the phone, please do roll call, Gabby.
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Sanchez,
Yes.
Thomas,
yes,
Leonard.
Yes. The
Thank you.
ordinance is approved and moves forward.
That's all I have this morning. Thank you.
Okay, thank you, Mr. McMahon. Moving on to the sheriff's office, Sheriff Fain.
Yes, good morning, everybody. So all reports are on file. I don't have a PowerPoint this time. I'm sure you're all disappointed by that, but I just have a brief statement on behalf of my staff. So we've tried to be very transparent and communicative about what my office has shifted to doing over the last 6 months, and in response to the coronavirus, working lockstep with the health department, coroner's office, anyone else we can assist. And of course, now we are reporting to the CAAC committee. And as I've done throughout my term, I try to bring our staff members forward. And so we can showcase, their expertise and their capabilities and help truly explain what we're doing. And if it is a request for assets, that we clearly explain what that request is. So we love questions. We love answering them. We completely understand and respect no votes. We completely understand and respect dissenting legal opinion. And one thing that I have to speak out against and I cannot tolerate is words that make our staff feel that their requests that protect the community, that protect them, protect their families when they go home to their families, are that our work or our requests are overzealous or a mission creep was the words that were used the other day. And when I have to walk out that door and I have members of my command staff turn to me and say, Sheriff, have we not been doing what the county wants or needs us to do over the last 6 months? And I have to reshift and reboost their morale when they're already spread thin and overworked during this last 6 months. I just ask that as elected officials, we understand that our words carry a lot of weight. And again, I think it's all the time for us to come together and work together. That's all I'm asking for. And I have a resolution to move to after that.
Okay, before we move the resolution, Sheriff, I'd like to say that, number one, I, as a county board member, and I think virtually all of the county board members truly appreciate what you and your office do. And we respect your work, and we understand that any requests made by your department are necessary to ensure public safety. We also realize too that during this pandemic, you've had to go above and beyond your normal duties, and we want to thank you for everything that the department has done. I would appreciate it as chairman of this committee if you would let your commanders and all of the deputies in your force know that we are truly appreciative of everything you do. And I apologize if in fact there was anything that was said that was misinterpreted or gave the wrong impression to you. I know as a board as a whole, we all respect everything your department does, and we're very appreciative.
I appreciate that. Thank you.
Anybody else have a comment for Sheriff Hain? Seeing none and hearing none, we'll move on to the resolution. I need a motion and a second on this resolution. Moved by Mr. Martin, seconded by Mr. Sanchez. Sheriff, would you please go over the resolution with us?
Sure, this is stemming off an emergency purchase affidavit. So our hazardous materials and devices team maintains what's called a magazine. It's basically a bunker for hazardous materials and explosive devices. In March, that bunker flooded over on the old Fabian property and destroying some of the interior and some of the devices that were inside of it. So this is a purchase to replace that. Currently, we had to separate out these devices across the county into temporary safe structures. This would relocate the new magazine onto the new campus, roughly between the MUF building and the sheriff's office. And also IDNR requires that it has a berm be built around it. So we attempted to file an insurance claim. Our deductible is more than what the magazine costs. The magazine is about $15,000. The deductible is $50,000, and insurance will not cover the berm construction or the movement of it. So we have enough space in our general fund budget to acquire this and do the construction.
So once again, moving this bunker and reconstructing it on the campus near your office and the MUF building, you are taking funds out of your account to pay for this totally. Is that correct?
That's correct.
Okay. And that amount equates to $126,213.80. Does anyone on the committee or anyone here have a question for the sheriff on this resolution? Seeing none and hearing none, Gabby, would you please do roll call on that?
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Yes.
Sanchez, Thomas,
yes,
and Leonard.
Yes. Resolution passes. Anything else, Sheriff Rain?
That's all I've got. Thank you.
Thank you very much. Moving on to judiciary and courts, Chief Judge Hall is not able to attend. One of the judges had a family emergency, so he has to take care of his court appearances. And Mr. Naughton is able here to handle that report and answer any questions. So Mr. Naughton.
Good morning. If you want to take a look at what Judge Hull is doing, just click on the streaming site in courtroom 305 and you can see him in action. But other than that, we have nothing else to report.
Any questions for Mr. Naughton? Seeing none and hearing none, thank you very much, Mr. Naughton. Appreciate you being here. We do have a resolution, I believe, under your premise here, the resolution, and I'll be happy to go over it. And then if there are any questions on it, of course, the committee can ask. But the resolution authorizes the transfer of the remaining fund balances from the juvenile drug court to the adult drug court rehab court.
Mr. Leonard?
Yes. Oh, I'm sorry. I guess Ms. Ost will handle that. So thank you, Mr. Naughton. And we'll move on to court services and Ms. Ost.
And that is the thing that I would like to talk about. So I guess I'll wait for that to be.
Yes,
for
if we could have a
discussion.
motion and a second on that. Moved by Mr. Sanchez, seconded by Mr. Martin. Ms. Ost.
Cool. This is really kind of a housekeeping resolution. I'm trying to consolidate accounts and revenue into the adult drug court. Just by way of background, back in 2007, this body passed a resolution allowing Kane County to collect a drug court fee to be used in support of drug courts. At that time, we had two courts. We had juvenile and adult drug court. But with the ACA passage, they greatly expanded the kinds of treatment and coverage that insurance would cover, as well as expanding the age of what is considered to be a juvenile covered under their parents' accounts. And so what we saw was that participation in juvenile drug court really declined. It declined significantly to the point where it just wasn't feasible to sustain it anymore. We only had 2 participants in 2018 or 2017, so we closed it. So this resolution is just asking for the revenue that was sent to juvenile drug court to be redirected to adult drug court It's the same fee. It's by statute only to be used in support of drug courts. And I will also say that I heard that there was some discussion the other day at the Riverboat Committee about why adult drug courts no longer needing riverboat funds. And just as a reminder, we actually have gotten 2 back-to-back 3-year federal grants that we've been using for treatment. And so it was 2 3-year grants of $300,000 each, which we've used for treatment. And so while we've been receiving that money, it allowed this other revenue stream to build up in these accounts, such that right now juvenile drug court has a cash balance of $100,000 and adult drug court has a cash balance of almost $400,000. And typically our treatment costs range about in the $100,000 or so mark a year. So this will help sustain that program. And we've moved the personnel line item off of Riverboat and into the general fund. So this will be used to support the drug court going forward. And it's just really a housekeeping because we've closed juvenile drug court and I want to move all the funding over to adult drug court.
Wonderful. Very clearly and succinctly explained. Any questions from Ms. Oss before we vote on this? Hearing none and seeing none, Gabby, would you please take the roll?
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Sanchez,
Yes.
Thomas,
yes,
Leonard.
Yes. Resolution passes. Anything
Thank you.
else, Ms. Ost?
No, we've been busy, and Mr. Davis is going to talk a lot, and hopefully he'll allow me to jump in if needed.
Well, thank you, Ms. Ost. Mr. Davis?
Good morning. So as all of you I'm sure are aware by now, on August 2nd, we had a minor who was exhibiting symptoms of the coronavirus. He was taken to Del Norte Hospital for a rapid test and he was found to be positive. At that time, he and the other kids in his unit were medically isolated and we directed several staff members to quarantine at home that had been working in that minor's living unit. On Monday afternoon, the following day on August 3rd, we found out that a staff member also tested positive. He had gotten tested on Saturday afternoon. We further restricted movement of all the other residents in the building and quarantined additional staff members, consulted with the Illinois Department of Public Health, the Kane County Health Department, contacted building management who had the building cleaned and disinfected, and we diverted all new admissions to other detention facilities. On Wednesday, August 5th, every minor and every staff member in our building was tested. We received those test results back on Friday, August 7th. 3 additional minors that were also in the same living unit as the original minor who tested positive were found to be positive, and 3 additional staff members. Right now, we have all of our kids who are positive medically isolated in 1 unit. They're visited by medical staff at least twice a day, usually more often. They're visited by mental health professionals frequently. We're doing everything we can to keep them, to look out for their mental health and to keep them comfortable. None of them are, the majority of them are not exhibiting any symptoms. The ones that are, they're very minor symptoms. We've been giving them, flexible pencils, crayons, books, music in their rooms. We've been pushing a TV into the living unit so that they have something to watch. Those kids are getting showers and phone calls every other day, and the Regional Office of Education has supplied educational packets. I guess I should have mentioned before that once we found this out on Monday the 3rd, we decided not to bring the teachers back because at that point we didn't feel they were essential at that time. So we've also limited the movement of the other kids in the building even further than we already had. Those kids are still allowed to go outside. There's showers, phone calls daily, recreation activities and TV time, but we don't have more than 2 kids up in a pod at one time. Yesterday, all of the staff members and all of the kids who tested negative the first time around, we all retested again, and we hope to have those test results back sometime between now and Saturday. As you can imagine, it's been a lot of work and there's been a lot of people putting in a lot of hours because there's a lot of moving pieces. So if I could just really quickly, I really want to thank Lisa, and she's been wonderful to work with, and our assistant superintendent, Amy Sierra, all of my supervisors, especially Victor Rivera, Stephanie Soriel, Crystal Zinda, and Duran Kaplan, our PREA coordinator, Pam Ely. We contract for our medical care, and our nurse, Ashley, has been working very long hours, and she's been doing an amazing job. Our youth counselors have been great. I can't ask for more. Everybody's had a really positive attitude. Our cleaning crew has been wonderful. We have 3 young ladies who work in our building that go above and beyond every day. So I know there's a lot of times where we point fingers at the cleaning crew for not doing a very good job, but these 3 ladies do a great job. Building management's been wonderful. Ricky getting people out there to clean our building. Sheriff Hain, the Department of Emergency Management, has been very helpful, as has Barb from the Health Department. Judge Hall, Doug, Andrea, everybody's been wonderful, and we've all been doing everything that we can. So if anybody has any questions, I'll be happy to answer them.
And then I'll chime in with one thing. Mike is not letting you know, he was actually on vacation when we found out that there was a positive in the building, and he drove 13 hours in one day to come back the very next day to be here to lead the ship. So he's been a wonderful leader during this time, and he's trying very hard. We've done a lot of conference calls with the Illinois Department of Public Health and the Kane County Health Department, all of the juvenile judges, the chief judge, Judge Hall, and Mike's team. And we feel like we've got a handle on what's going on. But as you know, I mean, it's an unpredictable virus. The new things come out every single day, how easily it's transmittable. And what we have found is that of the 8 people that we know who are positive, only 2 ever had a fever. And a lot of these people had never had any symptoms. They were completely asymptomatic. They were shocked that they had tested positive. And so that's why we've restricted movement so much. And we're really working hard to try to figure out exactly what's going on.
Any questions for Mr. Davis? You know, number one, Mr. Davis, I'd like to thank you for all the work you've done, for you going above and beyond when you were out of town on vacation to come home, and for all the procedures that you are following and taking to keep this at a minimum. And it's a daunting task. We understand that. But we want to thank you very much for everything you're doing, Ms. Ost, and everyone else involved in this situation. And thank you very much for all your efforts, both of you.
Thank you. I appreciate it.
Moving on to KingCom, Ms. Guthrie.
Yes, good morning. Our monthly reports are in the packet. We did not include our phone report this month. In the transition of the phone project that we have the data that resides on a different reporting base, and then some new data that is in the new phone base. So it would not be accurate numbers if we reported it this month, but we'll be sure to include it next month with both totals. Other than that, we just have a resolution on the agenda this month.
Okay, before I ask you to explain that to us, if you would, Ms. Guthrie, I'd like a motion and a second to move that forward. Moved by Mr. Kenyon, seconded by Mr. Sanchez. Ms. Guthrie.
Yes, thank you. This resolution is for the upgrade of our Eventide recording system. As we explained a couple of months ago, we received another grant this month from the state of Illinois. It's a Next Generation 911 grant. It will support the upgrade of our recording system to record text, video, photo when it is available. It's not available through the state now, but this will put us in a position where we are ready when the state allows that technology to be in place. So the grant that we received is for $47,219. And the total of the project is just over $51,000. So the total for KingCom's responsibility is just about $4,000, and we have those funds to cover it.
So the lion's share of that then is through the grant that you received, you applied
Correct.
for and received of over $47,000. Any questions for Ms. Guthrie on that? Seeing none and hearing none, Gabby, would you please take the vote?
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Sanchez,
Yes.
Thomas,
Yes.
Leonard.
Yes.
Okay.
Resolution passes. Anything else, Ms. Guthrie?
That's all. Thank you.
Well, thank you very much. Moving on to the Merit Commission, Mr. Ziz.
Good morning. Our report is on file for the Merit Commission. My name is Todd Zees, Z-I-E-S. The past couple of days, we've been doing testing for patrol sergeants and lieutenants for the past 2 days. Next week, we're going to be doing interviews, and the promotion list stays in effect for about 2 years. Corrections and corrections lateral applications are available now through August, and we're going to be let's see, we're going to have for the laterals, correction entrance will need to take the written test and interview, and correction laterals are going to be taking the interviews only. If you have any questions, our report is on file.
Any questions from Mr. Zees? Seeing none, hearing none. Thank you very much,
All
sir.
right. As of right now, we have probably 3 or 4 applications in for corrections. It's a little early in the month right now. We're about halfway through. Usually we get 50, 60 applicants with about 30 to pick from. We'll have to see what happens at the end of this month so we can put together a list because of the retirements and things that are going on in the corrections office. So we're going to be moving forward on that, okay?
Very good. Thank you very much.
You're welcome.
Moving on to the circuit clerk, Mr. Hartwell.
Good morning. We have our report on file. What we're looking at this point is we're about at 75% of case activity, both filing and cases to court. A large portion of that is traffic tickets that citations that just aren't coming in at this point. Revenue projections show that we're still going to be a shortfall of over $2 million revenue compared to prior years. And if anyone has any questions, be glad to entertain them.
Any questions for Mr. Hartwell? And Mr. Hartwell, I'd like to congratulate you. I hear you became a grandfather recently and you have a little granddaughter now.
I did. It was,
Well, congratulations.
I've been told that it's a wonderful time in a life, and you know what it is. It's fantastic.
Well,
She's well, and only sad thing is she's down in Texas instead of being up here. But
Well, thank you very much for the report and congratulations on the granddaughter.
thank you.
Moving on to the public defender, Ms. Gonit.
Good morning. Thank you. Our reports are on file. I would concur with Mr. McMahon that our numbers are getting back to more normal in the amounts as well as the types of offenses that we are being appointed to. The only other thing that I have this week, we are maintaining our status quo of our new normal, and part of that is this week we have sent 3 new attorneys to a training that the Illinois Public Defenders Association puts on yearly. The difference this year is that it is all by Zoom, so we're very interested to see how that goes because in our office we are looking to start back up our training program as well. That's all I have.
Very, very good. Any questions from Ms. Gonit? Seeing none and hearing none, thank you very much for your report. Moving on to the coroner, Mr. Russell.
Good morning, everyone. I'm also a grandfather, actually 2 months. So my little
Congratulations,
thank you.
Mr. Russell.
Yeah, it just reminded me. Get to see him every day because he lives about a half a mile from me. So it's actually quite a blessing. And I'm just, anytime there's life, positive in a positive direction, it's good when it comes to my career. But anyways, I wanted to get back and just tell you that our numbers are up, as you can tell. We are, and I do have a presentation if you want me to go through it. Otherwise, we can, no?
I think everyone received that.
Okay, good.
But please go ahead if there's anything else you'd like
Sure.
to.
Where our numbers are up, just the raw numbers themselves are up 22% this year. We're about, as of July 31st, we were 409 more deaths than we had last year at this time. So obviously, what does that translate into? It translates into more people need to go out, more investigations need to happen. In addition to, I know it's a knee-jerk reaction to blame everything on COVID, but I think in my case, it does affect, obviously what we do. Overtime-wise, we've been very diligent about keeping our people safe. And how we've been doing that is we've had several tens of homes and issues, places we've had to go to pick up COVID positive bodies. So we actually have to do a 4-man team. It's something that we policy-wise that made sense to us. And actually, we 2 people go in, and those are what we consider the dirty team. They're the ones that are in direct contact. And then we have what we call a clean team. And the clean team actually, obviously keeps things sterile and everything. And it's been successful. We've not had anybody contact the disease yet. So very positive on that. I think it's a very good thing. None of my people, obviously, we have 5 deputy coroners and a couple of administrative assistants. We're a pretty small office. So when we get hit with somebody that's knocked out from this thing, it really hits us. So what does that translate into? It translates into overtime, unfortunately. So the other thing is the autopsies are up. So yeah, beyond that, I don't have any questions if everybody's seen my PowerPoint and everything.
Before we present the resolution, I need someone to move it and second it on the committee. Moved by Mr. Kenyon, seconded by Mr. Martin. Mr. Russell, the budget adjustment resolution that you're presenting is for $192,787. We realize that cases are up. I do think that there may be the possibility that some of this might be reimbursable through the CARES Act.
Yes.
Don't know for sure. I'm just making a hopeful assumption that it will be. Does anybody have any questions for Mr. Russell on this resolution for the budget adjustment of $192,000? Mr. Martin?
I just have a procedural, I'm supportive of the resolution. I have a procedural question about timing. Normally we do budget adjustments at the end of the fiscal year. Is this?
Well, this is a little bit different. We know it's not going to lessen. It may even increase a little bit more. So I think it's something that we want to look at.
Okay,
now.
well, all I want to do is just
Yes.
understand the process. So, okay.
I think one of the differences is that we are out in our line item for autopsy right now. We are in the negative for autopsy. So that's the only reason I brought it forth now.
Yeah, and that is in the amount of $143,387. So we understand that. I believe we need to move this forward, but any questions from the committee? Seeing none and hearing none, Gabby, would you please take the vote?
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Sanchez,
Yes.
Thomas,
Yes.
Leonard.
Yes.
Okay.
Resolution passes. Thank you very much, Mr. Russell. And congratulations on your new grandson, too. Unfortunately, today, we don't have any need for executive session, so. Yeah. We'll move on from that. I need a motion, a second, to place our written reports on file. Moved by Mr. Sanchez, seconded by Mr. Kenyon. Please take a vote.
Martin,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Sanchez,
Yes.
Thomas,
Yes.
Leonard.
Yes. Reports are placed on file. If I understand correctly, and I have the state's attorney here to correct me if I'm wrong, but for adjournment, we can do a voice vote. So I need a motion and a second to adjourn. Moved by Mr. Kenyon, seconded by Mr. Martin. All those in favor say aye.
Aye.
We're adjourned. Thank you very much.